Imagine knowing you have a significantly increased chance of developing a serious illness, one that is very difficult to detect early. What if there was a proactive step, albeit a very significant one, that could potentially prevent that illness entirely? A prophylactic pancreatectomy, which means surgically removing the pancreas specifically to prevent cancer, is a highly specialized and rare procedure. It is only recommended in extremely specific, high-risk genetic circumstances where the lifetime risk of developing pancreatic cancer is exceptionally high and close monitoring is insufficient. The primary reason such a drastic measure is considered is the aggressive nature of pancreatic cancer, which often progresses silently and is diagnosed at advanced stages. For individuals with certain inherited genetic mutations, the lifetime risk of developing pancreatic cancer can be 70% or even higher. These germline mutations are passed down through families and can include changes in genes like PALB2, CDKN2A, or those associated with Lynch syndrome or Peutz-Jeghers syndrome. In these cases, the preventative removal of the pancreas eliminates the very organ where the cancer would likely originate, offering a definitive way to avoid this often fatal disease. However, it also means lifelong management of diabetes and digestive issues, as the pancreas plays vital roles in both. Deciding on a prophylactic pancreatectomy involves extensive genetic counseling and a thorough evaluation by a multidisciplinary team of specialists, including oncologists, surgeons, and geneticists. For those identified as extremely high risk through genetic testing, the journey often begins with careful surveillance protocols, such as regular magnetic resonance imaging or endoscopic ultrasounds, to monitor for any early changes. The option of preventive surgery is typically discussed only after careful consideration of the risks and benefits, and when the surveillance methods are deemed insufficient to reliably detect cancer at an early, curable stage. This decision is not taken lightly and typically occurs in specialized academic medical centers with extensive experience in pancreatic diseases. These situations involve a meticulous assessment of the individual's specific genetic mutation, their family history of cancer, and their overall health. The goal is always to balance the severe, lifelong consequences of removing the pancreas against the virtually inevitable and often devastating outcome of developing pancreatic cancer when the risk is so profoundly elevated. It is a highly individualized decision, tailored to the unique circumstances of each patient. Ultimately, the recommendation for a prophylactic pancreatectomy is a profound and complex one, reserved for individuals facing an extraordinarily high genetically determined risk of pancreatic cancer. It represents a critical, albeit life-altering, strategy to prevent a devastating disease. If you or a family member have a known genetic mutation linked to a very high risk of pancreatic cancer, discussing all your options, including rigorous surveillance and the potential for preventative surgery, with a specialized medical team is an essential step towards safeguarding your future health.